Hi, folks. Thank you for joining. We'll get started here in just a minute or so and allow time for folks to trickle in. All righty. Well, I have the top of the hour on my clock, so we'll go ahead and dive in. Hello and welcome, everybody. Thank you for joining today's webinar. We are in the midst of our 2022-2023 Better Buildings webinar series. We're dedicated to bringing you the latest actionable insights from leading industry experts. And this annual series is a chance to explore the topics, technologies, and trends that affect your organization, as well as efforts to accelerate decarbonization and energy efficiency adoption. We can go to the next slide. Today's webinar is called Diversity, Equity, and Inclusion in Climate Planning. And before we dive in, there's a couple housekeeping notes we want to cover. First off, today's webinar will be recorded and archived on the Better Building Solutions Center, and we'll follow up when today's recording and those slides are made available. Next, you'll notice that attendees are in listen-only mode, which means that your microphones have been muted. But if you do experience any audio or visual issues throughout the webinar, please go ahead and send a message in the Q&A box located at the bottom of your Zoom panel. Next slide. My name is Bree Colin, and I serve as a fellow in the Building Technologies Office at the U.S. Department of Energy. I'm thrilled to serve as today's moderator for this webinar. We can go to the next slide. Just as an overview for the webinar today, for agenda, we'll start off with a brief introduction. We have some welcome polls to get folks acclimated to our polling and Q&A platform. And then we have wonderful speakers here on this important topic coming from a variety of different sectors. And then we'll finally close with some Q&A and concluding thoughts from folks. So the next slide. So I mentioned our interactive platform. So today we'll be utilizing what is called Slido for Q&A and polling. So if folks could go to www.slido.com, either on your mobile devices or computers, by either opening a new window in your internet browser. Today's event code is # or #DOE. And if you'd like to ask our panelists questions at any point during the webinar, please submit those questions utilizing Slido, and we'll be answering those at the end. You can select a thumbs up icon for questions that you'd like to upvote, which will result in the most popular question moving to the top of the queue. Next slide. And without further ado, we're happy to start off with those polls. We'd like to learn a little bit more about you all. So if you'd like to join us over at Slido to respond to the following questions, and again, if you do have any issues, please message our tech support team by utilizing that Zoom Q&A function. All righty, so we can transition to the first poll. Okay, we're off to the races here. We can already see folks inputting their responses. Thank you all for joining us at Slido to input this information. So I wanted to just first get an understanding of who's in our virtual room and what sector best describes your organization that you're joining us from. So I see first off a strong representation from local government to start off. We have a good amount of folks coming from nonprofits, NGOs, contractors, state government. We could scroll down a little bit and just see some other sector representation that folks are inputting. That might be great. Might not be able to scroll down on the screen to see more, so that is totally fine. Well, wonderful. Please take a moment or so to input some more answers, and we can transition to the next poll. All right. So first off, one of our initial questions we want to ask folks is, does your organization have a climate action plan? So the topic for today's webinar, again, is diversity, equity, inclusion in climate planning. So first off, we're kind of curious if folks do have a climate action plan. We recognize that a lot of the terminologies that different organizations might use might not technically call it a climate action plan, but typically we find that these might be the more holistic, aspirational, organizational-wide plans that folks are developing for the purpose of reducing emissions and implementing a variety of different practices in the sustainability area. So I'm seeing folks say either yes or something's in progress. Some say no, and then others have selected the option for other. So thank you for inputting that information, whether your organization might have such a climate action plan. That's just a moment or so on that. And for these plans, again, they might not delve into the details necessarily of the nitty-gritty of implementation, but might focus a bit more on those aspirational, holistic goals. Great, we can go to the next poll. Seeing a wide variety of folks do have a climate plan in the room, so that's helpful to know. If you did choose other, would be really interested to learn a little bit more about that, because we did see certain percentage selecting that other option. So I'm seeing here, if we're scrolling down to on some of these short answers, some folks might not be sure if they do have a climate action plan at the organization. Some are attempting to start a partnership and looking into some more processes there. And I'm seeing some other sentiments shared about not being sure. They do know that they have capital deployment goals with the emission reduction focuses, but not framed as a climate plan. That's helpful to know. Our actions might reside within our sustainability and community vision plans. That's completely fine. We know there's a lot of, again, different terminologies that organizations might use for something like this. Or it's integrated throughout other plans. That's great to know. Or sustainability action plans, again, with some different labelings there. Others support local governments and develop and implement those plans. And then other folks are not having us do anything so formal yet, and maybe something to continue on in the planning for the trajectory for the next few years. So that is really helpful. Thank you for folks who did select that other option to share more additional details here. Certain folks are going through a request for proposal process to prepare that plan, and that's a lot of times some common processes that folks use in this planning process. Well, wonderful. We can transition to the next poll. And for those that do have a type of climate plan or something similarly related, we wanted to get a lay of the land for folks. It is DEI, diversity, equity, inclusion. Is that intrinsic to your organization's plan? So I'm seeing some answers here. And again, for folks that do select that other option too, we'll have a subsequent area to fill in a little bit more details. But I'm seeing so far 47% of folks responding do have those considerations being intrinsic to those plannings. And then others are either having elements that are in progress, and then some folks may be looking to incorporate more foundational aspects in their plan going forward. I'll pause for a moment or so to let folks continue inputting that. I see the horse races bars there still altering slightly, so thank you again. This is really helpful, valuable information for us to collect. All right, with that being said, we can go to the next poll, which just shows a little bit more details about those that did select other. And I'm seeing some folks mentioning they're not sure within their organization if DEI is intrinsic in that planning, so that's helpful to know. And Justice 40 applying to specific initiatives, some believing it should, but maybe in those beginning stages again of that planning process. And while DEI is heavily important in certain organizations and purchasing and hiring practices, there might not be that formal climate action plan. So that's really helpful to know. Helpful barometer too to get to see where folks might be unsure. It may be a good note for organizations too to make it a bit more clear and actionable too within those planning processes. Wonderful. Thank you for sharing those additional details for those that selected other in that. We can go to the next poll. One of our last questions here is, for those that did mention, I know there's a large percentage that did mention that DEI is intrinsic in those plans. This short answer is really just to get at a little bit more details there and to dig in in what form that is encompassed in your organization's climate action plan. I know sometimes this might be a big question, so feel free to take your time in inputting this information. as we go throughout today's presentations, we'll still have opportunities to continue to input this. So feel free to take your time and type in as much as you'd like. So I could see we have some responses rolling in. First off, it's being one of the foundational pillars of the plan. That's great. All strategies within the plan must adhere to it, and that definitely speaks to something being really, those considerations being intrinsic to that. Environmental justice being one of the core goals. And then there could be a separate climate equity plan I'm seeing from some folks. I'm specifically mentioning Minnesota's climate action framework and how DEI is intrinsic there, or really crucial in the strategic planning or as being a main focus for folks' organizations. All right, this is really great. Thank you all for answering. We'll pause here just to give folks a moment or two inputting this information. And some still may be in progress. I'm part of the planning going on, and others are historically focused on ensuring that programs are better reaching for historically underserved communities. Helpful to know if DEI is a guiding principle, but did not verify that all strategies adhere to that principle. Seeing some responses flow in here to that effect, and the importance for others in advancing environmental justice and DEI being core to those plans. In certain regions and localities, I see specific mention here, for example, to NYSERDA as a government agency. It's mandated by the Climate Council in New York City that similarly to the DOE Justice 40 program, that benefits of the programs must go towards 40% of disadvantaged communities. That alignment. Wonderful. Well, thank you all again for inputting this information. Again, please take your time. The additional information is really helpful to inform programming. So great, we can go to the next slide. And without further ado, happy to transition it into our presenters. We have first off, Shanda DeMorris. Shanda is the Associate Director for Climate Engagement and Education at Healthcare Without Harm in Practice, Green Health, where she supports decarbonization and climate-smart healthcare delivery throughout the sector. Dr. DeMorris earned her Doctorate of Nursing Practice in Health Innovation and Leadership from the University of Minnesota, and she holds the Lead Green Associate credential through the U.S. Green Building Council. She's also a cardiovascular nurse with horticultural training. Shanda is the co-founder of Nurses Climate Challenge, a national campaign to educate 50,000 health professionals about the health impacts of climate change. Dr. DeMorris serves as an affiliate faculty member at the University of Minnesota School of Nursing. We're thrilled to have you here today with us, Shanda, and without further ado, I will turn it over to you.
Thank you so much, Bree. Good morning. I just want to check quick that you're able to see me and hear me. Magnificent. All right. Well, thank you so much to your team and the Better Buildings work for the invite to spend some time with you today. As we get going, I want to invite everyone who is joining us. This is really critical work, all of which is a work in progress. And I certainly don't claim to be an expert at this intersection. I'm here as a messenger to share some of our work at Healthcare Without Harm, to pass along some of the stories that we're seeing with health systems, and to hopefully convey some resources that might be helpful for you all in your work as well. Let's head to the next slide. So to do a quick drive through of what I'd like to share with you all today, I'll spend a little bit of time just connecting on the why we're all here, how the built environment contributes to climate change, why we need to make a plan in the first place. I'll speak a little bit to how climate change impacts human health, and in particular, how climate change disproportionately impacts particular communities. We'll get into some examples from healthcare, and I'll share a model called Climate Smart Healthcare with you all. And then we'll shift into what the risk for not taking action can look like for us. And then we'll lead into some resources as well. So away we go. Next slide. So first, to orient to healthcare without harm and practice green health. Healthcare Without Harm is an international nonprofit that's about 26 years old. We have the primary goals of protecting public health from climate change, transforming the supply chain within the healthcare sector as it pertains to the environment, and building leadership in environmental health. The primary way we do that is through our scaling model, which we call Practice Green Health, which is a membership network of hospitals all across the United States. There's also an international contingent called Global Green and Healthy Hospitals for folks outside the US on the line. But currently we have over 1,500 hospitals across the US that are working with us to implement environmental sustainability initiatives across the full spectrum. That spectrum is very wide, as you all know, everywhere from kind of getting styrofoam out of the cafeteria to developing robust climate action plans and going towards net zero. So our network is wide, and we are committed to helping these health systems decrease their environmental impact with the mission that drives what we do in the healthcare sector, which is to do no harm. Next slide, please. So certainly healthcare and any sector contributes to climate change. It is just natural and inherent in the way that our systems presently work in this nation. So if we look at the US healthcare sector from an emissions standpoint, it's estimated that approximately 8.5% of emissions in this nation are from the healthcare sector. That is antithetical to the do no harm mission. And kind of getting an idea of where emissions are coming from in the healthcare sector, it's comparable to other building sectors. We have a few sort of unique areas that our greenhouse gas emissions come from. For instance, waste anesthetic gases is kind of a nasty contributor to climate change. Our supply chain impact on emissions is actually the largest percentage of where in healthcare we contribute to carbon dioxide, methane, sulfur hexafluoride, et cetera. But ultimately, some of the work that we're trying to do is to help health systems develop inventories of where their emissions are coming from in the first place so they can develop mitigation plans, and beyond that, resilience plans for climate action. Next slide, please. So here's where it gets sticky if you're a hospital, if you're a nurse, if you're a physician, or really just if you're a human out there that cares for the communities that you're living in. Environmental health and climate change has an impact on our health. From extreme heat, wildfires, severe weather, hurricanes, tornadoes, vector-borne disease, nutrition-related issues. We're seeing more and more climate-related health impacts across populations. Now, you can probably imagine that communities that are disproportionately impacted in the first place, folks with economic disadvantage, people with lower socioeconomic status, lower education status, marginalized populations, sometimes even the youngest or the oldest of us are impacted most disproportionately by health impacts of climate change. And on this next slide, I like this graph from the EPA. So this dives down into some of the social vulnerability issues within our nation and how climate specifically impacts those populations. So for example, kind of looking down that y-axis on the left, we see a few categories: low income, minority, no high school diploma, the aged population. And you can see that on the right here, there are various climate impacts that have far greater impact for the most part on some of these particular populations. And so it's important to convey, first of all, what's happening within your communities and within your audience that you're creating a climate action plan for. And there are some really critical assessments that I'll share with you in a little bit to help figure out what this looks like in your community. The most robust and effective climate action and climate resilience plans will be tailored to the communities in which your service, your government, your business exists. Next slide, please. So, as you heard, I'm a nurse by background. Of course, I'm biased. I'm fortunate to be part of a profession that has been identified as the most trusted profession for the last 20 plus years in the United States. Certainly, I'm joined by colleagues in the rest of the health professions as well that are in a really unique position. And I share this because I encourage you to sort of extrapolate what makes your profession unique when it comes to climate action and developing mitigation and resilience plans, or even that concept of climate action. Why might somebody from the healthcare professions be valuable at this intersection? I mentioned that we're trusted. We're also influential. While we have close to 9% of emissions in the US that come from the healthcare sector, there's also a very large economic impact of the healthcare sector, of course. But probably most important, health sector across the United States, but also internationally, were considered community anchors. So community anchors are key institutions within communities that need to exist, need to have strength during times of crisis. So another example could be universities. We'll hear a little bit more shortly from some examples in Colorado. Other examples could be key community centers. So when we look at that from a health sector perspective, I notice there are a lot of folks from government, from NGOs on the line. If health sectors are anchor institutions and anchors within communities, we can be really powerful partners for all of you in developing your climate action plans, not only that are specifically tailored to whatever your audience or contingent is and the health audience, but mostly the communities that we're collectively serving. Next slide, please. So this is just a fun little moving image about how we at Healthcare Without Harm try to scale our climate action work. And again, think about extrapolating this into your own setting. We're working to shift the decarbonization and resilience momentum, I would say, across the healthcare sector. That has touch points on the supply chain, on policy, advocacy, community resilience, and the vision is climate smart healthcare. I'll tell you more about what that is in a moment. First, let's talk about federal momentum on the next slide. So fortunately, we're seeing, let's head to that next slide, thank you. We are seeing a big shift in the last few years that has had a positive impact if you're in the healthcare business and you're looking to decrease emissions and build increased climate resilience. At the end of 2021, the Biden administration came out with an executive order that mandates decarbonization for federal healthcare facilities. So those are VAs and DHA or Army buildings and hospitals. Shortly thereafter, right around Earth Day in 2022, Health and Human Services released a climate pledge, and these are both linked in here. The climate pledge in particular is unique because it's open to non-governmental health facilities. It's open to those private hospitals and those community hospitals that are in your neighborhoods. And this pledge has been signed by over 800 hospitals presently, publicly committing to three specific components. One is to reduce organizational emissions by 50% by 2030 and by 100% by 2050 in scopes 1 and 2. So there's the gap, is that it's not scope 3. However, the second component of this pledge is to develop an inventory of scope 3 and have executive support behind reducing those emissions, but it doesn't explicitly ask for those emissions to drop by 2030 or 50 in the same way as scopes 1 and 2. But the third piece here of that pledge is that it asks for health systems to develop climate resilience plans, and this is verbatim, to include community in those plans. So hundreds of hospitals have publicly committed to this. So here's where healthcare without harm comes in. Next slide, please. So we are helping health systems to establish those climate plans in accordance with our climate smart healthcare model. So if we look in the lower left, one of those pillars is mitigation, decreasing emissions, of course. The upper circle is leadership. Part of the ways in which we support mitigation is through advocacy, both at the state, but also federal level. And then looking to resilience in the lower right-hand corner. So we define resilience even more specifically than from an adaptation perspective. Let's look at the next slide. Climate resilience for us and for health systems, and perhaps in what your industry is as well, looks like a 3-pillar model. Again, we factor this into healthcare facility resilience, public infrastructure resilience, and community health resilience. So this is very strongly where the DEIB, diversity, equity, inclusion, and belonging component comes in, is for the community component. How do we help our users, our clients, work with community in the first place to develop plans that are effective for them? Next slide, please. What are the costs of doing this ineffectively? So I know this text is a little bit small. This is from our Safe Haven in the Storm report from 2018. It goes through several climate crises and what it can look like when disruptions occur within an anchor institution, in this case, a healthcare center, faces a severe storm. For instance, there can be disruptions in operations, in our healthcare delivery, disruptions in supply chain. For instance, when Hurricane Maria came through Puerto Rico, some of the key manufacturers down there that supplied IV bags and IV medications were totally wiped out. And there was a major disruption in supply chain across many US healthcare facilities. If we shift to that green section in the middle, you see increased costs from storms, which of course makes sense. That's across capital, supply chain again, those operations. Perhaps there are direct losses. There are also issues related to insurance premiums or lower retention of staff or reduced revenue, reduced clinical demand, and lower reimbursement rates. So this is a collection of impacts that can occur to an institution if there are not strong resilience components. So I'd like to shift, we'll go 2 slides down. We'll go one more here just for time. So a specific tool that health systems are using to build those plans with community is the Guide to Community-Based Resilience Planning. This is right live on our website. And this includes steps for planning and executing a community-based climate resilience exercise, convening stakeholders to identify what the needs are as citizens within a specific community. There are steps in here for actual sample agendas, presentations for pulling together a convening exercise, even a facilitator guide. So this makes it very simple for our healthcare users, but also this can be deployed in your setting to learn more about what's needed and how to respond. And on this next slide, we have tools. Oh, I'm so sorry. I just want to speak to the tools for the end user quickly. We have systems using the CDC's Social Vulnerability Index, again, assessing what's in your community to respond in kind. And I want you to take a look specifically on these bullets on the right-hand side. There are content resources for climate-ready communities, adaptation equity portal. There was a great question about justice earlier. So when we think about climate planning, I want you to include the vernacular of adaptation and resilience in addition to the mitigation component, because that is where the critical aspects of community orientation and DEI come in most strongly. So as we go to our next slide and get ready to hand off, core to our mission in healthcare is the human. Core to the mission in the institutions you're working with is probably the human too. And so as you're establishing these plans, I already know that you've started to put together the dots of other departments and other groups within your organizations that need to be included. And this planning certainly can't happen in silos. So next slide. Certainly, this is a powerful moment in history. Every moment is a powerful moment in history. I look forward to having some discussion and Q&A with you after this. And the last comment I'd like to make on my last slide here is that if any of this has been compelling to you, please do join us at CleanMed in 2023. We have a conference that we host annually. We'll be in Pittsburgh this year, and this is where health systems, community leaders, policymakers, local and state government officials join us all to help in the mission to do no harm. So thanks again for the opportunity to join. I'll stick around and look forward to the discussion after. Appreciate it.
Thank you much, Shanda. Thank you so much. That was really valuable information to get to share more about the importance not only of the healthcare community, but also the ways in which folks can partner with those institutions in their localities. So really appreciate that, and definitely encourage folks to look into CleanMed coming up here in May to register. All right, so just want to give a quick reminder too to our audience to send in any questions that you have utilizing www.slido.com. Again, with that event code #DOE, and we look forward to answering those questions at the end of the session. Next up, we have Tony Miyamoto. Tony serves as the Director of Communications and Sustainability for the Division of Student Affairs at Colorado State University. Tony is passionate about sustainability and inclusion, and she founded the Eco Leaders Peer Education Program in 2010 to help encourage and engage residential students, particularly students from underrepresented groups, to take an active role in sustainability leadership amongst their peers. Tony serves as the co-chair of the President's Sustainability Commission and helped lead Colorado State to the first ever STARS, which stands for Sustainability Tracking Assessment and Rating System Platinum Rating within the organization of ASHE. Tony holds a Bachelor of Science in Journalism from the University of Wyoming with a certificate in Women's Studies and a Master's of Science in Technical Communications, as well as a graduate certificate in Women's Studies from Colorado State University. Thank you so much for being here with us today, Tony. I will turn it over to you.
Thank you so much, Bree. It's an honor to be with you all today and engage in this topic. It's one of my favorite things. We're going to look at diversity, equity, inclusion, and belonging and sustainability from a couple of different lenses. We can go to the next slide. We're going to look at it from the people component, which, as Shanda mentioned, is that human element, the policies component, which also includes planning, and a places component. So next slide. A little bit on Colorado State University as we get started here. We are a Research One university located in Fort Collins, Colorado. We have about 33,000 students and 7,500 staff members at the university. We are a predominantly white institution. We have about 25% diverse enrollment, 23% first-generation students, and 20% low-income students. We are Colorado's land-grant university, and we have a mission of access. We have over 13 million gross square feet of our buildings. Those date from the 1880s through to today. So we have it all. We have old buildings, new buildings, stadiums, laboratories, a rec center, an animal hospital, classrooms, and even a museum. We have 42 LEED buildings on campus, and we have 41 solar arrays now on our buildings and on our land. We also have one of the largest geo-exchange systems in the Western US under our intramural fields. And as Bree mentioned, we have participated in STARS, the Sustainability Tracking, Assessment, and Rating System from ASHE, since the pilot in 2008, and we have since earned 4 platinum ratings through STARS. Next slide. So in talking about integrating DEIJ, coming at it from the people, the policies, and the places perspective, I think we're often tempted, those of us who like to put things together and see them take off, to jump right to the programs and places and then wonder later, why isn't this more inclusive? Or what are we missing here that we could have been paying attention to? So we started to recognize that the only way to truly integrate diversity, equity, inclusion, and justice was to start with the people, to have diverse voices around the table as these things were coming together. And that for us includes race, ethnicity, nationality, language, religion, gender, sexual orientation, disabilities, and socioeconomic status. And for us as a land-grant institution, also looking at rural and urban perspectives. And while it isn't possible to have every voice around the table for every decision, we did learn that it's possible to tap into existing networks and committees, whether those exist within our university or within our local community or within our local government, to seek input and feedback. There's always a group, an affinity group, an expert group to turn to ask. And developing that strong network of inclusive voices was critical to the next step of then being able to create inclusive policies and plans, whether those plans are climate action plans or strategic plans, or you're creating a very specific policy. We found that the groundwork was with the people. And once those policies and plans are in place, it then becomes possible for the programs and the places to become very inclusive. Next slide. So with the people, when we started this journey in 2010 and I looked around the table, I saw a lot of similar identities, which I think is a common experience for predominantly white institutions and organizations. Our privileged faculty, staff, and students were the majority of the folks serving in our student government, serving on our sustainability committees, and being part of our climate action plan group. That population was even overrepresented for our demographics. And so we started to take a deep dive into how do we include more diverse voices at the table. We asked ourselves, who's here, who's not here, and how can we start to invite that dialogue? Next slide. In creating a DEIJ pipeline, we started by identifying the barriers. Why are some people at the table and some are not? What we found was that our frontline staff, who are our most diverse staff group, couldn't get away from their frontline jobs to serve on committees and working groups. And our underrepresented students didn't have any previous experience to qualify them for leadership positions. So we knew that we needed to have a new and different model. And that's how we started the Eco Leaders Peer Education Program. It was intentionally designed with no experience required. The idea being that any student, whether you're a student of color, a first-gen student, an LGBT student, an international student, or a low-income student, you have a perspective and a lived experience to bring to the table, and you didn't have to have sustainability experience previously from high school or from the beginning of your college career. Same thing with our frontline staff. The people working on the front line do the work day in and day out. They have a perspective that's very valuable. So for example, as we started to interview students, we realized some of our rural students had nothing on their high school resume related to sustainability, but they'd grown up on a farm and they absolutely knew how to compost. Or we would talk to students, Native American students who had grown up on reservations, and they understood a food desert and had ideas about how to start to break that cycle. And we had students who had grown up in the city and understood the impacts of pollution on underrepresented populations. Those same folks shared with us that they can't afford unpaid internships and positions. And our frontline staff can't afford to have committee work or working group pieces be expected outside of the workday. Those folks need paid positions to help cover the high cost of attendance, or in the case of our frontline staff, lower incomes. So creating pay for our eco leaders was a critical part of inviting them to the table, and creating time periods for our frontline staff between, say, the meal rush or after the cleaning rounds for the day are concluded for our custodians, to then be able to do committee and working group work during the day and being supportive of identities and what's required for folks to come to the table. And mentoring was the piece that we've discovered was really critical for both a peer perspective and from an advisor perspective. The peer perspective can share, this is what the journey is, I'm on it with you, I have some tips to pass along. And the advisor role is that piece that can help open the doors. If I've been on this journey and I can help with the next steps, what might be in front of you. And open membership was very critical. We have realized when we looked around our President's Sustainability Commission that most of the folks who were represented were people who were tenure track faculty or were administrators or were staff who'd been long serving, and they had a certain level of privilege in being able to come to the table. We now have first-year students sitting at the same table as our vice presidents, and that has opened up a really meaningful dialogue for both sides. It's very mutually beneficial. We also discovered that trust has to be built before transformation can occur. So providing space for ongoing and deep dialogue was really critical. The eco leaders stay in one cohort through the full year, and they take a course together in both the fall and the spring, where they're engaging in a discussion-based course each week, and they have a lot of activities with their engagement between meetings. With the President's Sustainability Commission, we meet once a month, and then we have a number of subcommittees and working groups that meet between meetings. And what we have found is that most of the breakthroughs actually happen outside of formal and structured meeting times. Members will get together one-on-one or grab a coffee, and then they come back to the group and say, hey, we have an idea or a proposal. And we've seen some of our biggest movement happen through that. It's been 13 years now since we started this journey, and we're seeing a difference with who's at the table. And the further we get into it, the more we realize how much work we have left to do. Next slide. From a policy and planning perspective, once a diverse mix of voices are at the table, inclusive policies can start to be developed. And we have just a few examples I wanted to share. One is our inclusive physical and virtual campus policy. One is our green building standards. One is our LEAD. And then we have two plans that also benefit from this process, our climate action plan and our strategic plan. Our strategic plan at CSU includes a sustainability strategic plan. Next slide. And in creating these policies and plans, we started asking ourselves a series of questions to see, are we getting at what we hoped to get at? So we ask ourselves things like, who benefits from this policy or this plan? Who is not being served? Who have we not considered in our process? How can this policy create an inclusive culture? And what barriers exist that we can remove? These can apply to any level of plan, whether it's a small one or a really big, large one. It also works when we're doing collaborative relationships with our city or with our local government. And we've often paused on a vote once we've asked these questions because we realize we're missing input from a specific group, or we haven't quite considered this angle, and we can go back and improve the work and or make a revision to the plan to be more inclusive. It also has helped us anticipate what the feedback or concerns may be. So I included a picture of our students protesting because they do that on occasion. And in asking these questions, we have sometimes been able to identify who's not being served by this and how might we see that missing piece play out. It helps us be more proactive in anticipating what the feedback may be. Next slide. For the inclusive physical and virtual campus, that policy includes things like gender inclusive restrooms, lactation rooms, reflection spaces, commuter showers, public bike and EV transportation, break areas for frontline staff, and creating accessible and welcoming spaces both virtually and in person. During design charrettes, we found that the accessible and inclusive features like the restrooms, the reflection spaces, the solar panels, those are thrown out and everybody absolutely loves the idea. But as the project moves forward and the budget becomes reality, these are often the first features dropped to bring the project back into budget. And the only way to ensure they remain is to require them. Thus the reason the policy has been created. Once they become a standard, a gender inclusive restroom is considered a restroom. And a commuter shower may be a design challenge the first time, but by the third time, it's standard procedure. Break areas are something that we were overlooking. We often considered private offices when we were designing buildings, but we rarely thought about how to welcome and support our frontline staff who often do the most challenging and physically demanding jobs in the building. And we learned it's important to survey building occupants and visitors to learn what would make this space more welcoming for you? What are the barriers for entry? And what would help you feel included in this space? Next slide. Using a case study of gender inclusive restrooms, I'm proud to say that our students pushed us to really move the needle. We'd had it in a lot of planning as a goal, and it started with a class project in 2016. All 250 single stall restrooms on campus were inventoried. We had very few gender inclusive restrooms. And what the inventory showed us was that some simple low impact conversions could create a large number of gender inclusive restrooms. Some of these bathrooms required only a sign and a privacy latch to become a gender inclusive restroom. Some required some minor remodel work, and in some cases we were able to achieve ADA compliance as part of the remodel. Within the first 2 years, we had converted 195 restrooms to gender inclusive, and we currently have over 300. It is now standard procedure for new buildings to include gender inclusive restrooms, and we're now tackling the most challenging renovations. We've also added free period products to those restrooms, and it's something that has become an expectation on our campus rather than something that we hoped to do, we had good intentions to do, and just hadn't quite got there yet. Next slide. From a policy and programs perspective, we then looked at how can the people and the policies and the plans that we have in place make engagement in our spaces more welcoming and inclusive. Next slide. So looking at inclusive buildings, when people feel welcomed and comfortable in a space, we learned they will stay. And how can we use our space to support diversity, equity, inclusion, and justice? So just a few examples. In our first LEED Platinum building, we had 80 square feet open when all the plans were coming together. That could have been a private office. We challenged ourselves to build a living lab. And what we did in that 80 square foot space is we opened the Spoke, and it is our student-run bike repair shop that now completes thousands of no-cost bike repairs per year. The way the space operates is student mechanics are paid to provide repair services to their fellow students. And for our low-income students and our first-gen students and our international students, it's really critical to have a bike on campus. They often don't have private vehicles, and bikes break on occasion. And this system allows students to help other students learn to do the repairs and to do them at no cost. And it's been a model that has really supported our campus as a platinum level bicycle-friendly university. We also looked around at some existing spaces to see what can we do with spaces that are currently being used for storage to create more integration of DEIJ. And what we found was an area that had been used to store computers and old files, and it happened to have capacity to do a freezer in it. And we converted it into our permanent food pantry during the pandemic. And that space now serves over 400 people per week in an area that had been very underutilized previously. And a pocket pantry can literally fit in a closet. So we've introduced many pocket pantries across campus and learned that those can sometimes make the difference between someone eating that day or going without a meal. Next slide. So as Shonda mentioned, anchor institutions can be a critical partner in the community. And so we're going to do a quick case study here of our Hydro building. The CSU Spur campus is new, and it serves as an anchor institution in the Globeville and Elyria-Swansea neighborhoods in Denver. And an anchor institution are place-based, mission-driven entities such as hospitals, universities, and government agencies that leverage their economic power alongside their human and intellectual resources to improve the long-term health and social welfare of their communities. And it's about a lot more than having a physical address. It's about becoming a positive and contributing member of the community. Next slide. For us, the anchor institution framework includes developing relationships with local nonprofits and schools, engaging in existing community activities, focusing on college readiness and college access, which may include tours, scholarships, and supporting nearby small businesses and hiring locally. The CSU Spur campus is focused on lifelong learning with research, education, and outreach central to how we inspire the next generation to pursue careers and educational pathways in food, water, sustainability, and health. Spur is free and open to the public and houses a mix of research and education paired with family-oriented educational offerings for the local community. The value proposition is that Spur is an interaction between professionals and scientists from the university and kids and families in the community, giving young people a chance to envision themselves in college and in various careers. Something as simple as encouraging the events and programs that are held there to cater with local restaurants has already made a positive financial impact for the surrounding neighborhoods. In short, CSU Spur is a new pipeline for CSU in a Denver neighborhood we would not normally have a presence in. Next slide. The Hydro building is specifically devoted to water in Colorado, which for those of you in the West, you know that water is becoming our scarcest resource and one that we're putting a lot of time and effort into research and improved systems. It's an interdisciplinary space, and the local community is predominantly Latinx and low income. So this is a place where people are able to come and learn about research at the university and do some hands-on engagement. We have demonstrations of stormwater management, a green roof, gray water reuse, bioswales, research spaces in collaboration with the Mile High Flood District and the City and County of Denver using captured stormwater, irrigation, and garden spaces that rotate what's grown each season. So for example, we have an indigenous garden, a salsa garden, a low water food plants garden, and a community garden. Spur hosts community-led events that are no cost to attend, and we're excited to expand that this summer into outdoor events like monthly movie theaters and community focus gatherings. All of our educational exhibits and materials are bilingual. They're offered in English and Spanish. And with the collaborative innovation space, research and teaching labs, community and educational space, and outdoor research and learning, we feel like we're making an impact in the community at the same time that we're able to showcase for people who are not always able to make it up to our campus. Next slide. In closing, I just wanted to make that connection between DEIJ and belonging. So I leave you with a quote: "We long to belong, and belonging and caring anchors our sense of place in the universe." So thank you all, and I'm excited to go on to the questions portion of our webinar.
Thank you so much, Tony, for that valuable information and sharing a lot more about those case studies that really exemplify at Colorado State University the importance and the value of DEIJ in the policies and practices. And I think a lot of folks can learn a lot from the lessons and best practices implemented at CSU. Happy to move on to our Q&A portion. So if you haven't already, please join us over at slido.com with the event code #DOE to select and upvote questions. On our previous slide that was just showcased, we do have an additional resources document too. So before we transition to that Q&A, did want to encourage folks to utilize that additional resources document. The URLs and links that were included and encompassed in Tony's and Shanda's presentations are compiled in that handout. And so please don't hesitate to look into those resources on today's topic and additional things that we find folks will find this useful. So thank you all for adding information to make that a robust and valuable resources document. As we transition now to Q&A showcased on the screen, I see folks have upvoted current questions, so happy to transition into those. First off, this one will be directed to Shanda. There at the top, some folks mentioned that their experiences with some healthcare and communities has been historically insular and sometimes difficult to approach the healthcare community, whether it being resistant to suggestions from outside itself. And that may be also due to a lot of conflicting priorities, especially within the healthcare community in general. So the question here is, I know we saw at the beginning the representation from local governments, so just a curiosity around how do local governments reach out to start these conversations and start really to emphasize the collaboration, Shanda, that you mentioned that is really crucial in this process?
Excellent question. Yeah, thank you for posing that. First, I want to talk about the elephant in the room in the United States healthcare sector, which is we like to think that we are in place to help build healthier individuals and families and communities. Simultaneously, we have a very complex for-profit sometimes or fee-for-service model, and the dollar sign is the bottom line. That's a problem. That's a nut we're still working to crack. So that's the background that all of these folks that I've spoken about today in healthcare sustainability and climate planning are contending with. That's the lead in. The second piece I want to point out is, yes, I think you're right on the nose here that this has historically been hard to reach. I would like to suggest start out with the institutions that have publicly expressed commitment to this work. And I alluded to this a little bit with that Health and Human Services Earth Day pledge. So there is likely a hospital or an institution right in your neighborhood that has committed to this, to decarbonization and resilience planning at a system level. On that resource link I shared, it lists publicly every single hospital. That's an excellent place to start. They've publicly committed to it. I would also suggest thinking about, coming in with an angle to connect with healthcare leadership on items that are material to them. What's keeping health system executives up at night? Or what's keeping legislators up at night? Or what's keeping CEOs up at night? In healthcare, a big issue obviously relates to, yes, the dollars, but also staffing is a big one. I like to get at, there's a Deloitte Global Millennial and Gen Z survey that comes out annually. This is applicable to any industry. And in healthcare, global millennials and Gen Z, so millennials and Gen Zs, those generations, make up the largest percentage of the healthcare workforce. This survey evals, I think it's about 15,000, and those survey participants identify climate change and sustainability issues as being between numbers 1 and 2 as their key reasons why they select where they work. So that applies to healthcare and likely your industry. And so getting at an angle where you can merge climate and sustainability with these other issues, we're getting at DEI, or whether it's staffing, or whether it's financial security, or you name it, there's a place for climate to interact there. Thank you. Back to you, Bree.
Thank you so much, Shanda. I know it's a really important question. It really hits home on one of the points you mentioned too in your presentation around the importance of collaboration with healthcare in the development of folks' climate plans, to make sure that they're not creating either strategic plans, climate plans in a vacuum, and really hitting home on the importance of the localities and communities in which folks are situated in. It definitely, I know a lot of that similar terminology that yourself and Tony shared in terms of being a community anchor. Healthcare institutions are really crucial in that respect, and we saw it especially during and throughout the COVID pandemic around the important work that healthcare communities were really doing to ensure our continued longevity and health and safety. So thank you for those important insights. I did want to jump down a little bit to a question for Tony. I know, Tony, in a similar fashion, I know you were talking a little bit about the importance of looking around, like who's in the room, who's at the table. And so there is a specific question around the policies and practices that CSU implemented in participating in the Eco Leaders program in particular. There's curiosity that folks had whether DACA students in particular were involved in those conversations. And I think, too, Tony, to your point, the importance that the planning processes that will then subsequently benefit communities of all different diversities. It's helpful that they're involved in the process of those plans. So that was one question that I'm happy to turn over to you.
Yes, absolutely. DACA and undocumented students are absolutely included in our Eco Leaders program. And we also have a network on campus for undocumented and DACA students that's been really valuable to tap into when we have policies and plans that we'd like to have reviewed, because there are different impacts for students in those populations, as well as some of our international students who are impacted by decisions we make. So absolutely.
Thank you so much for sharing, Tony. Great. Well, jumping down here, this is kind of another question, Tony. I wanted to jump down similar to one that was posed to Shanda, but folks are wondering if you have any recommendations for, and maybe if you'd like to expand a little bit more on CSU's experience of how CSU has collaborated with the local community of Fort Collins or the state of Colorado on equity and climate issues.
Absolutely. We're a state institution with limited funding, so we often partner with our city and our local government for grant opportunities to bring opportunities into campus, to create internships for our students and pathways to graduate school. So we would not be able to do a lot of what we do if it weren't for the partnerships we have. And we receive a lot of grants from the federal government and from companies that are invested in this work. That helps us fund various programs that we have for students, particularly our undergraduate research opportunities and opportunities for students to be able to get out into the field.
Thank you so much for sharing, Tony. I think that importance of that collaboration is definitely key. So helpful for other folks in whether they're coming from state and local governments, just to understand how best to collaborate with folks in that spirit. So, well, wonderful. I know we have a couple minutes left here, so you may have time just for one more question here. I did want to direct one to Shanda here. And this might be speaking to some of the resources you shared, Shanda. If there are any particular case studies or examples of healthcare systems including equity in their climate action planning. I know folks are interested just to hear a little bit more about specific examples. I mean, if there's a particular resource you would direct them to.
Yeah, you bet. I'll fire that one off quickly. Thank you.
Sure.
So that community guide action plan resource that I referenced on the slide, and it's linked in the resources guide, that was used by Bay State Health System in Springfield and Western Massachusetts, which actually has the highest asthma rates across the nation. So that was used very explicitly as a tool for that group. The University of Utah is doing some really compelling work as an academic medical center. So they're merging their health system climate action planning with what they're doing in the university. And that seems like it'd be intuitive, but so often we find that, again, the left hand doesn't know what the right hand is doing. So if that's an opportunity for you, that would be something I would really encourage too. And they're centering equity again. They brought in an external consultant to do that, which is always an excellent idea. If there's not an internal team, look outside to see what expertise can be lended.
Thank you much, Shanda. Thank you so much for sharing those additional case studies for folks to look into. And I realize we're at the top of the hour, so happy to transition to some of our closing slides. I know there were a lot of great questions still there. We'll share those outstanding questions with our speakers, Shanda and Tony. And if folks are able to have capacity, we'll be able to follow up with some additional responses to those questions. So without further ado, I did want to mention just a few closing items here. Thank you again, everybody, for your questions and for Tony and Shanda's insightful responses. This webinar is a part of our 2022-2023 Better Buildings webinar series. And as you can see, we have a great lineup of presentations throughout March. And then for our upcoming summer webinar series, I encourage folks to stay tuned for that announcement in the next couple of months. Please visit our Better Buildings Solutions Center to learn more and register. Next up, if folks can still hear me, I'm happy to keep talking. I don't know if my camera might have gone out, but next up, we hope you'll join us on Tuesday, March 7th for our webinar entitled It's Electric, Electrified Alternatives from Industrial Fossil Fuel Systems. Please join this webinar to learn from our Better Plants partners about the benefits and challenges in implementing electrified systems in your facilities. Next slide. And then finally, we're pleased to announce our registration for the 2023 Better Buildings, Better Plants Summit. It's now open for registration. The summit is being held in the heart of Washington, D.C. on April 11th through the 13th. In addition to engaging in interactive sessions, attendees can look forward to plenty of opportunities to network with their fellow industry, peers, and experts. So please go ahead and explore the session tracks and book your accommodations on the Better Buildings Solutions Center. And for our final slide, I'd like to thank again Shanda and Tony so much for being here with us to discuss this important topic and taking the time to be here. Feel free to contact our presenters directly with additional questions. And if we couldn't get to your question during the Q&A period, a great opportunity to connect with these folks to dive in a little bit more. I encourage everybody, I've said it once, I'll say it again, the DOE is hip, so we've got some social media handles here if folks would like to follow us and learn more about our evolving information and resources coming from the latest news from the Better Buildings program. So you can find those handles and those respective links on the left side of the slide there. You'll receive an email notice when today's recording, slides, and transcript are made available on the Better Buildings Solutions Center again. Thank you everybody for being here with us today, and I hope folks have a great rest of your day.